We have to find real solutions, and this is Bending the Trend. Hello, and welcome back to Bending the Trend with your podcast host, Norm Volsky. And today we are thrilled to be joined by David Fosgate.
Hi, Norm. Thanks. The fact that you're thrilled is a real compliment.
Yeah, absolutely. Our pleasure. So, David's one of our favorite consultants, in the market. And, we would love to ask him about, some of the most innovative strategies he's had. David, I do want to emphasize the boxing gloves are for fighting rising healthcare costs, which we're on the same side of the fight. So, this is super friendly. And, I know you're one of our allies here. So, David, with some of your clients over the last handful of years, I'm sure you've implemented some great solutions. What are some solutions that some of your clients have implemented in the digital health space that you would go out of your way to recommend, that really did a great job for your clients?
Yeah, no, great question. Assuming you want me to name names, which is fine,
Yeah,
because
that'd be
that'll be,
great. We want to
an
bring
advertisement for
awareness to the good actors in the
right,
space that are doing great work.
advertisement for their services. Uh, One, we like a lot is Hinge Health. You might have heard of them.
Oh yeah,
Uh,
they've been a good client over the years. I met Dan
yeah.
and Gabriel 10 years ago when no one had heard of them yet. So they're a great success story.
They're doing a good job out in the marketplace. I mean, as you know, they're in-home digital physical therapy. They take a sort of a preemptive posture, trying to keep company employees and or their dependents from having musculoskeletal conditions that further manifest themselves into bigger issues later.
Yep.
So that's a cost avoidance play.
Yeah, they can
Uh,
avoid about 2/3 of unnecessary surgeries, which is insane savings, at the
yeah,
employer level. And it's a lot of avoided pain and suffering for the patient.
that's right. I mean, hopefully that's new information for this podcast, or I'm mentioning them for the first time. I don't know, but
Yeah.
they have a higher compliance rate than traditional physical therapy because it's in home and it's digital. I actually used them personally about 2 or 3 years ago for kind of a sort of lower back hamstring pull thing I had going on, and you know, great to do it in my home basement and right in the comforts of home.
I'm
They
glad you're recovered and, back at it.
right, fair enough. Uh, there are a lot of great cancer care programs out there in the market right now, particularly important for self-funded groups.
Hmm.
I know Private Health Management has cancer care guidance,
Yep.
which, we here at Lockton have implemented for, those clients interested in it and, having maybe a higher rate of neoplasms or cancers in their population,
Yep.
care coordination, second opinions. Uh, Something they do well also is that they have some case studies of actually having found some misdiagnoses of some cancers and or misapplication of treatment or a care path where they can dig in and kind of fix those things, which again over time hopefully leads to longer lifetimes
Yep.
given the severity of the diagnosis and or lower cost and spend over time. And it's an altruistic program as well for those employers where healthcare is table stakes and they want to take care of those employees and families and in some pretty critical times that could be scary and confusing for those families.
Yep.
uh, I mean, I'd be remiss, and you tell me, but for mentioning our own in-house pharmacy consulting team.
Yeah. Tell us
uh,
about it.
yeah, here at Lockton. I mean, basically, they can work on a project basis. So we can come in, regardless of that company's current broker partner, focus on pharmacy, focus on that spend. I mean, as you know, per member per month, pharmacy claims have been increasing
Yeah.
year over year for most
It
groups.
used to be just such a small percentage, and now
Yeah,
it's like that and medical are, getting pretty similar.
yeah, 20 to 30% of overall claims spend for some groups, whereas years ago it was a fraction of that.
Yep.
And our team can work with companies on monitoring those pharmacy contracts with their pharmacy benefit managers, making sure they're properly paying discounts and rebates. Look at RFPs, go to market, do price checks, make sure and we are negotiating for the best terms and conditions, consider coalitions, other things like that. So again, that's where we've seen for some larger groups millions of dollars of savings, given our efforts.
I like it. I like it.
So those are some ones that leap to mind and seem to be most often talked about, in this market. And the MSK or musculoskeletal stuff, the neoplasms, I mean, those are pretty prevalent in most claims, for companies.
Yeah, and with your Lockton clients that have implemented a Hinge or private health management, what are some of the data on savings and, surgery avoidance and other things that really stick out to you that, again, are the reason you mentioned them by name?
Well, we've actually validated Hinge's ROI. By
That's
that
great.
I mean we did a project looking back at our larger self-funded groups, from whom we're able to harvest really good and granular data.
Yep.
Throw it into our own proprietary data warehouse, that today has close to 4 million members in there already, with really deep claims analytics. And we've seen year over year trend for musculoskeletal conditions where we've implemented Hinge, decreasing, typically on a year over year basis in terms of per member per month spend.
20% of healthcare spend.
Right. Yeah.
I think it's like a couple percentage points of the total GDP of the US.
Yeah, it's a lot. And on the cancer stuff, that's more episodic. And there are many different types of cancers. Some that require larger cost therapy, or kind of care paths, for treating that. So we are seeing, to the point of your podcast, really bending the cost curve for some of those items. And again, the ROI can be found, and then there's simply the emotional ROI, like I've talked about, for those companies that want to support those families going through a pretty tough time. On the pharmacy side, like I've already said, I mean,
that was clear in just immediate
millions.
Cost savings, millions.
That's right.
Unbelievable, which is really great. And our belief is if you can save in these areas, you can reinvest in other areas, whether it's other technologies or just pay your people more, give them more take-home pay, maybe even lower copays, lower deductibles, all these things, are options when you save money in different really, really high cost buckets.
Fund HSAs. We have a lot of employers doing that, helping, again, employees pay on a tax favored basis for their cost of care. And redirect those dollars even to other point solutions where we're seeing spikes or peaks and claims upticks.
Totally. What is an area of healthcare that there are no solutions to your knowledge that you would love to be created over the next couple of years? We're trying to inspire the next group of entrepreneurs to tackle some big challenges that employers are facing.
I was thinking about that, and believe it or not, for all of the discussions, meetings, and work we've done, I'd say that's a tough question, and the reason being is we've seen so much money invested in upstart point solutions and in so many categories of care over the last 10 years, a ton of venture money being thrown toward it, where, in those categories, including family planning, cancer and MSK care, like I just said, behavioral health, virtual primary care. I mean, there's a new upstart out there focusing on cardiovascular health.
Yep.
It's such a fertile field that, smart people are using that to create great companies and solutions in those areas to help bend that cost curve. I mean, anecdotally, what everyone's has top of mind these days is just the overall cost of healthcare.
Yeah.
And, that's more than a vendor. That's financial, that's political, that's corporate.
It's structural in some ways. Like some people say like healthcare is broken. Some people say it's designed, it's working exactly as designed. Just wasn't designed for the patient or the employer. So again, part of what we're trying to do is create a grassroots movement that, unless employees and employers as a whole band together, advocate for themselves, status quo will stay the same, because a lot of groups benefit off nothing changing, including
Right.
pharma, PBMs, carriers, health systems, and that's the uncomfortable truth, that exists. So again, just you alluding to ways employee benefits departments can start to, tackle some high cost claims areas can hopefully, make for some really significant change, which, we really appreciate.
I mean,
Um,
the current, I mean, just jumping in on that real quick. I mean, the discussion we have been having more often lately is around ICRAs.
yeah,
So the individual consumer health reimbursement accounts came out of COVID legislation. I mean, that is an area in which a lot of money is being thrown into third-party administrators that can administer that program for companies that are interested in shifting some of the cost or sharing some of the cost in new different ways with their employees. We have actually larger groups that are keenly, focused on those discussions right now, whether or not they'll implement the pros and cons either way. But
yeah,
that's been a discussion topic as of late.
yeah, absolutely. And again, David, thank you for joining us on Bending the Trend. Thank you for sharing some of your insights and some of your success stories over the years. And again, great at creating transparency that, there are companies really benefiting a ton off a handful of really great vendors. And thank you for shouting out the great actors that are just doing great work and providing great value. So thank you.
Well, Norm, thank you for inviting me to do this. It's been
Yeah,
great getting to know you, and this has been fun for me.
love it. All right. Thank you for joining. Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.